You realize that there's less than 7,000 of us geriatricians in the US. In about 10 years, 2035, I've taught my students that this is going to be a complete shift where you're going to see more seniors than younger people, like unprecedented. So, some of the strategies we talk about are.
Hello, everyone. Welcome once again to Medical Success Secrets. I'm your host, Theo Harvey, co founder of SensorMed. I am super excited about our special guest today, Dr. Nakeisha Rodgers. How are you doing today?
I am doing very good. I'm excited to be here. Thank you so much for having me.
Absolutely. Well, if you don't know about Dr. Nakeisha, she is the Jerry godmother. Dr. Nakeisha isn't just a geriatrician, she's a game changer in the aging space, a double board certified internist and geriatrician, Amazon bestselling author of Secrets of Sassy Savvy Seniors, Aging Like Royalty Roadmap, and a sought after speaker. She's redefining what it means to age with dignity, confidence, and power. As the CEO of Age Like Royalty, LLC, Dr. Nakeisha is on a mission to disrupt outdated narratives around aging. Through her book, The Secrets of Sassy Seniors, Caregiving Edition, online course, and high impact speaking engagement, she delivers real strategies for caregivers and families navigating the challenges of aging. Her expertise empowers families to choose the right providers, identify emergencies before they escalate, and cut down unnecessary ER visits without second guessing themselves. Her insights have been featured on parade.com, find a topdoc.com, and major podcasts, radio shows, and national conferences. Whether she's breaking down dementia care, helping families create independence driven aging plans, or tackling the tough conversations around caregiving, Dr. Nakeisha is giving caregivers the blueprint to take control and help their loved ones age like royalty. Dr. Nakeisha, thank you for that great introduction and all the things that you're working on. Yes, one of the things we like to talk about with our doctors, and we work with a lot of doctors that deal in this space, patients who are aging gracefully,
Yeah.
aging like royalty. One of the things that always comes up, I think, in the Journal of American Geriatric Society study found that nearly 60% of seniors' ER visits are preventable with proactive primary care. What strategies do you recommend for families to help their aging loved ones and avoid unnecessary hospitalizations?
That's a very good question. So you realize that there's less than 7,000 of us geriatricians in the US.
Wow.
And we are in about 10 years, 2035. I've taught my students that this is going to be a complete shift where you're going to see more seniors than younger people, like unprecedented. So unfortunately, we have this small pool of these specialists like myself who are trained to care for seniors, but we're trying to get the message to like surgeons, specialists, and so forth, because everybody is aging. No, I call them my savvies because they are very sassy. They'll let you know what time it is. My parents are in their 80s by the grace of God, and they are very, very sassy. So one of the things they will always tell you is, I want to be at home. So many of them, if you could pick between your bed and a hospital bed, the average person is going to pick which one?
Mhm. Your bed at home. Yeah.
You're bad, exactly. So, but we noticed that a lot of things kind of predispose to causing a hospital stay. For example, not booking your appointments frequently with your provider, and sometimes if you spread those appointments too far, like I always tell my students, as you get older, maybe seeing the doctor twice a year. Maybe you could get away with that, like when you're in your 20s or 30s and so forth. But as you start to get over 65, you want to maybe just check in even when things are doing well, because you're trying to be preventative. So you want
Mhm.
to, if you start to feel a little tummy ache or something in your extremities, you don't want that to kind of fester until you're and leading you to be rushed to an ER. So some of the strategies we talk about are, frequent visits. And these can be preventative visits. These can be planning visits where you kind of sit down and talk to your provider, like, if something should happen to me, which child do I trust to make decisions for me? Because I've been in rooms, trust me, Mr. Harvey, I have been there where it always happens. There's the one child that you always see at the family visits. And then lo and behold, another relative who you've never seen before saunters in. And, sometimes they're going through a lot. Maybe there's guilt. They haven't been in
Mhm.
contact with mom. And so you get a lot of that, the heads clashing. But if you hadn't had a visit with your primary care doctor or your geriatrician to discuss those things, that could cause a lot of chaos in emergency situations. So, first thing I would say is pick the right doctor for you, and have frequent visits.
Oh, I love that. Yeah, my parents are in their late 70s. We just celebrated my aunt's 85th birthday the other day. So my mother's sister. And so, yes, I definitely see that. We're based out of Florida. And so there's a lot of aging in place that's happening. My
Yeah.
parents don't want to go. They want to live where they live and they don't want to be in a place that restricts their freedom of movement. And so it is a challenge, as you have older parents and kind of helping them and guiding them and say, hey, you just can't do everything you used to do. So let me help you. So that's always a challenge when you, as a child, as your parents get older, how you navigate those kind of conversations, right? And so,
Because it kind of is the script reverse is like a role reversal as you get older, but they still, they still need to be in charge. So you have to navigate it
oh yeah.
carefully.
Well, I have kids now, so I'm teaching them now. Say, hey, you guys gonna take care of me. So I got you guys have to be smart and intelligent and wise. So when I give you control, you're gonna know what to do. So I get that. So when we kind of think about this new normal of healthcare and what's happening, seniors with a strong patient physician relationship is really important. We
Yeah.
have seen from JAMA Internal Medicine highlights like having better health outcomes, improved quality of life is
Yeah.
really important with that patient physician connection. How can
Yeah.
families ensure that their aging parents are receiving the best possible geriatric care?
I think really like understand what geriatrics means. I kid you not, like many times when I tell people what I do, they're like, huh, I never heard of that. What is that? So I always tell them like, okay, you know what a pediatrician does,
Yeah.
pediatrics. So most people are like, yeah, the babies. So then I say I'm on the opposite end. So it's like I go through all the seasons and you end back up with me. But again, I think it's really important for families to know if their loved one needs a geriatrician, because the big thing in our field is function. So
Mhm.
whereas, the primary care doctor is focused on like the chronic diseases, the diabetes, the stroke, and the hypertension, I'm looking at that, of course, with my internal medicine background, but I'm trying to see how does all that play into Mrs. Jones, like reducing her risk of falls? How does that play into keeping her home safely? How does that play into, if we start to see changes in her thinking, how do I keep her functional for as much as possible? So I think it's really important to find out, watch, do your research. You can go online. You can Google geriatricians. Just look up what it is. You go on sites like AARP, etc. You can get an idea of what it is we do. The American Geriatric Society is a society that has national meetings, and we're all a part of that. But find out, what we do. You can call us, see if you think your relative would be a good fit for us. And then realize that we're not just end of life. Like some people think that, oh, she's the lady for the person who's frail and so forth. And yeah, while I will see frail patients, I see a whole spectrum. I see people who are doing pickleball, playing golf, managing $1 million accounts. So
Yeah.
I see the whole gamut.
Yeah. Well, I think I read somewhere about like I don't know, maybe you know the statistic on this, but we lose muscle mass like every year as we get older and older. And so, I've been reading this book about aging and pace. I don't look at, but I'm in my late 40s, about to turn 50. So I'm looking at like, okay, do I need to gain muscle mass now so that,
Yes.
as I get older and it starts to lose a little bit more, I can still, do simple things like pick up my grandbabies and things like that.
Yeah.
So kind of talk to me about like, the importance of why you kind of created online courses, right? To kind of educating families about aging related medical concerns. How do you feel like, this digital education is really transforming how you practice medicine?
I think that, as we get older, just like what you say, we sometimes don't realize what's normal aging from what's like, that's not normal. So a lot of people, if you talk to them, they think, well, yeah, she's supposed to fall, or it's just a simple fall, or, that's just her memory go. And that comes with age. We always say it comes with age, or, she's changed a little bit. She's more withdrawn. It comes with age. And in reality, no, those things do not come with age. So what we try to do digitally, online, and in our small workshops is work with small groups, with, churches, civic organizations, and try to get people together that are going through these dynamics, that are caregivers or seniors themselves. And we try to walk them through like what's important to them in their healthcare, how to pick I keep on harping on that, because if you don't have a really good physician that you could connect with, it could send things in a different tailspin. So what
Yeah.
we do digitally is it allows us to do it, by Zoom, and so we have more engagement. And if there aren't people in a physical space, but what we're able to do is kind of go through module by module and just say, okay, first we're gonna let's start off at the basics. What is it that these people do? What are geriatricians, and how why haven't we heard about this if there's only 7,000 of these people? And then when we just discuss that, then the second thing is, do I need one of these people, or does my mom or my sister, or do I need them? My parents may not need them, but at least when I go through that stage, I know that they're available. And then what we do is once we find out, do you need one, how to select the right person for you, then I really like to explain to people like what's normal from what's abnormal in aging. Because a lot of times, family members, when the person's finally admitted to the hospital, they're like, well, I didn't know something was wrong. I didn't know I should have called somebody. I didn't know that it was time to have help come into the home. So we walk you through what's normal from what's abnormal. And I'm a teacher at heart. I love teaching. My parents were teachers in the Bahamas. Shout out to them. So I always grew up around a chalkboard. So now it's not a chalkboard, but it's, going on Zoom. So I love to see people learn, and I love to see people have knowledge. I'm a woman of faith. I totally believe without knowledge, you perish. I've seen the difference in my patient panels who, are reading, their family members are involved. They're active, they're asking questions, they're bringing me JAMA studies. I see that these are the people that are less likely to have an adverse event versus the other spectrum. And it's not their fault. Sometimes they have to work 2 and 3 jobs and they can't come to the visit. Or,
Mhm.
they're in the sandwich caregivers where they're taking care of their own children and having to take care of their parents. So they just don't have the support. But I know what it looks like to see people on the phone, desperate, crying, Dr. Nakeisha, I don't know what to do. I'm the only sibling. It's 5 of us,
Yeah.
but these other ones aren't pulling their weight. You could put us in any part of the world and you'll get the same. There's always that family. And my heart goes out to them because I know how it feels when you feel overwhelmed, you're frustrated, and then you start to make decisions that you necessarily would not have made if someone had told you years before, like, wow, if only I had known, I could have helped my mommy to plan.
Mhm.
So I'm big on education, and our goal is pick the right doctor, figure out what's normal from abnormal, and then let's start to figure out what could go wrong so we could make a plan to prevent that.
Yeah, I love that. Pick a plan. I'm definitely big into that and understanding that. One of the things that we're seeing with the advent of healthcare changes, telehealth, and remote care. I don't know if
Yeah,
you saw. There's some actual new CPT codes that are allowing for reimbursement for caregivers. So yeah, we can definitely share that with you. But because I know there's a lot of, like you said, older individuals who are also caregivers, right? So, like, they may have a older parent or older sister, right? They're caring for, and they're also
they
needing
need
help.
care too.
Yeah, and so yeah, CMS. I think it was like last year announced some CPT codes that allow for kind of like caregiving help and assistance in the primary care setting. So I can kind of send you those codes if you're interested in that.
That'd be
Um,
awesome.
yeah, because I think that's so important, especially as we're experiencing the graying of America, right? The baby boomer generation is getting older, older. People are living longer thanks to wonderful medications and surgeries. We're we're in the midst of the Ozempic revolution, so people are losing weight and helping
Yeah,
eliminate some of the obesity, chronic
yes,
illnesses. So yeah, so I think any way we can kind of help those caregivers, I think is going to be
yes,
important.
definitely.
Speaking of which, we work with a lot of primary care cardiologists, nephrologists, pulmonologists, and patients that suffer from these chronic illnesses, like hypertension, diabetes, COPD, and we kind of monitor them with these remote devices like a blood pressure or a glucose monitoring. What are your thoughts about this remote patient monitoring's role in kind of reducing emerging visits and improving chronic disease management for patients as they get older?
I think it's critical. I think with the whole AI revolution, I think this is right on time because a lot of you like for physical limitations, sometimes it's hard to physically get out to a doctor's visit. I know like when my sister and I schedule our parents' visit, we try to coordinate it where they go together. So they have to do blood work. We're like, this is happening on the same day because we can't have you go in here and you go in here. So And they prefer that too, because it's just too much on them to have to get up. So people have physical limitations. And then again, they can't get the bus. Sometimes I have patients who are like, Dr. Rogers, I want to come, but I have to make this appointment 3 days in advance. It's just too much. And a lot of times we miss when things change. So someone starts to retain fluid, or their O2 sat starting to drop down, but no one's aware of it until ultimately, someone goes there and they're unresponsive. So I think what you're doing, and I'd love to talk with you more offline, but I think remote patient monitoring is something that patients need to know about. I think that families need to be aware of it, and they need to be educated on, oh, does my parent benefit from this? How can we adopt this? How can we embrace this? And, get into a culture of bringing that information to office visits so that it could be a part of the assessments. So I think it's amazing.
Yeah, and we work with a lot of nephrologists, right? The old way of doing it was, to your point, creating a log and kind of logging that. But
Yeah,
because for patients who have, kidney disease, right, they suffer from hypertension is something they want to keep monitor of. Uncontrolled hypertension is a no-no. And so what we're seeing is now with these cellular enabled devices, they can take their blood pressure and it goes straight to the cloud and integrate it inside the medical record, right? And so the doctors are like, oh, I already see everything, right? And even remotely, they can change medications and help the patient kind of, and then the patient gets that peace of mind because they feel better connected to the doctor, right? So, oh, the doctor's watching my blood pressure. So if it does get unruly, I feel at peace. And so one of the things that we ran into too was, loneliness is a big factor part of that. And a lot of times when our nurses reach out to patients in rural areas, even, or just even in city, a lot of times I may be the only person they spoke to that week. And so they are feeling connected to someone cares about them. And they usually see that as a social time to have a conversation with someone. And so I think, social isolation, healthcare, I think there was a big study on like longevity. They're saying social fitness, like, are you staying healthy and are you connected to people? Those two things help you live longer. And so, yes, the technology and all that is great and wonderful, but if it's helping bringing people together with connection, feeling like
exactly.
someone's seeing the data, we feel like that's really what this is about ultimately long term. So.
No, that's excellent.
So, kind of tell me a little bit about like how did you get started in doing these kind of events online and working in this space? Obviously, like you said, there's only 6,000 of physicians that kind of specialize in this specialty. Number one, how did you choose this? And then number two, why did you choose to go down this digital path, right, and put yourself out there?
So, and I tell the story all the time. I'm like an old soul. So I grew up around, I always loved older people. There was just something about them I just really liked. And being on the islands, and people have heard this, are like, oh, she's going to tell the bakery story. Yes, I'm going to tell the bakery story. So I used to go to a school. So it was called Our Ladies, Catholic primary school in the islands. And every time I would go home, we would have to go down this road called Blue Hill Road. And there was a bakery, and it was an elderly couple. I think they had to have been in their 70s. And
Mhm.
for whatever reason, I was just 6, but I just liked going to this bakery. And my mother was like, why is she always stopping here? And then eventually they came inside and they realized that I was making conversations with the patrons. So it was the husband and the wife. And they would just ask me how my day was. And I just looked I would always find a way, we got to stop at that bakery. And I don't know, I guess it was God's way of just showing that, there's a connection that you have to them. And years later, I really enjoyed sciences. I found that it was something that I really enjoyed. I had some amazing teachers on the islands. And eventually I left the islands and wanted to explore medicine, obviously. But before I explored medicine, I went to Canada and I lived in Nova Scotia for a while. And at Nova Scotia, there was this nursing home called Wolfville Elms. I think it's still there today. And while everybody else would be like going to like a party or a social or whatever, where would you find me on a Friday afternoon? I was excited to go volunteer at this nursing home. It was
Mhm.
big. It had these big, huge walls and stuff. It was beautiful. And when I went in there, because I was an undergrad student in biochem, they would allow me to like play games with them. I was a part of what I was seeing was interdisciplinary care, but I couldn't appreciate it at that time. I didn't have the medical
Mhm.
background, but I was able to watch the doctors do their rounds and the caseworkers and do the activities. I would sit in their rooms and talk with them. And just gradually, I just like, you know what? I think I like older people. So eventually, fast forward, went to medical school, did residency, And when it was time to declare a specialty, everybody was like, "Oh, I'm doing cardio, I'm doing nephrology, I'm doing oncology, or whatever." And I was like, "Nakeisha, what are you doing?" I'm like, "Geriatrics." And they're like, what? And I was like, "Yeah, I love it." And I had a mentor. I still talk to him today. In fact, we always WhatsApp. And he just really encouraged me and said, if that's what you want to do, that's your push, go ahead and pursue it. And so I basically did just that. And so just pressed ahead and just really found a niche in it, and found that the care of an older person is very complex. People don't really understand, because when they make up the bulk of your hospital admissions, many of them are in the ICU. So a lot of my students now, when they're managing their hospital lists, they're realizing like, "Hey, Dr. Rogers, like half our list is over 65." I was like, "I told you." So, but it's fun because now they're able to say, okay, we may not have a study on this. We don't necessarily know how this is going to react, but we have to put the principles into play. Like, we know we have to adjust the medication doses. We know that we have to look out for delirium. We know that we have to, make sure that we have a sitter in the room. So they start to put their geriatric thinking caps on, because our patients are very fragile. So I just got into it for a love of just seniors, and they're very feisty. They're very humorous. They've earned the right to tell you the way they see it. I get so much life advice from them. They treat me like a granddaughter. "Yes, baby." So I'm like, I talk to them at first. We do the whole visit and all that, and it's like, "Okay, now let's hear about your life." So I get free counseling sessions. It's beautiful. So it's a win-win.
No, I love it. I think that's having that connection to wisdom, and
Yes.
that knowledge set. I'm sure they said a lot of things when you were younger that you saw ahead of the curve with some of your peers because of their life knowledge and stuff like that. So, just curious if you could sum up of all the knowledge you've gained over the years from speaking to older individuals. What are like the top things that come to mind of living a happy life?
I think an older doctor who's still in his 80s and still practicing. One time I had to call him about one of his patients, and he was just, again, out of the blue, didn't know I was a geriatrician because I was just giving him the sign out on his patient. He was like, one thing he always remembers about himself is that you're never as good as people say, but you're never as bad as people say. And that's just a humbling thing, just to kind of like, check the ego, but at the same time give yourself some grace. Like, you're doing some amazing things by the grace of God, but don't let it get above your head. Like, still stay humble and kind, and treat people with respect. So I think I when he said that, I really reflect on that, and I always remembered that. And then I just love the things that they would teach me. Just, if you've lived, once you've lived, you'll see it. So a lot of times you haven't passed through anything until you've lived. That's a common saying on the islands. You haven't passed through, you haven't seen anything unless you live. Well, you'll see it, you'll understand it one day. But I really like the nuggets that they give, and just seeing how a lot of them, they have their independence. And I'm like, one day, if I get to live that way, this is how I want my life to look. So how can I
Mhm.
give that gift to people now?
I love it. That's awesome. Well, where can everyone like find you and connect with you if they have questions about this space, or are you speaking anywhere anytime soon? Where's the next?
So our team, Age Like Royalty, if you go on LinkedIn at Dr. Nakeisha MD, you can find us on there. There's a link to book a call just for us to talk. You may be a caregiver and you're like, you know what, Dr. Nakeisha, I want to know, does my family need that? You can always book a call with us and we can talk with you. The book Secrets of Sassy Savvy Seniors, tongue tire, that's on Amazon, and it's a really short read, but it's really written to address those issues. And I kind of tell the stories that I went through anecdotally, so hopefully you can learn from those.
Oh, wow, that's wonderful. Well, thank you for sharing your knowledge, your wisdom of many years in this space. This has been a super exciting thing for me to just listen to you speak about, your care on this journey. And as a company that cares for older patients as well, we definitely see the same thing. And so physicians or nurse practitioners or clinicians who listen to this podcast, please go check out Dr. Nakeisha's website information if you have questions about how to better care for your patients, right, as they get older. But I think it's all important as we all try to navigate this new normal of healthcare. So definitely stay tuned for our next interview, everyone. And thank you.
Thank you. Thank you so much.
Hey, I hope you enjoyed that. Look, we have more content that can really help you accelerate your practice this year. We have tons of content that can cover all the different topics we discussed earlier. If you want to hear more, click to the right or to the left and you'll get more content to understand how to best grow your practice.